Hello, everybody. I'm Sam, and my presentation is on the benefits of exercise on individuals with depression. Millions of Americans live with depression each year. That is roughly 9.5% of the U.S. population. The graph here shows the number of depressed individuals versus the population of the United States. Depression is a term that refers to both a mood state and a clinical syndrome or disorder. As a mood state, depression is characterized as feeling sad, unhappy, and discouraged. While on the clinical side, depression is a psychiatric disorder in which an individual must meet 5 or more of the depressive symptoms in the DSM-5. Symptoms of depression include feeling sad, guilty, or helpless, reduced sense of self-worth, restlessness, irritability, trouble focusing and making decisions, insomnia or excessive sleeping, pessimism, loss of interest in activities, and changes in weight or appetite. Depression also has the ability to affect an individual's physical health. These symptoms affect the daily lives of millions of Americans, which also affects how they work. Depression is now the leading cause of disability in the United States. This totals over $40 billion being spent each year due to medical treatments and loss of productivity in the workplace. The biggest question here is, how do we treat this mental health problem? The most common treatment for depression is with antidepressants, with the most popular being a selective serotonin release inhibitor, also known as SSRI. Often utilizing medication alone will not alleviate enough symptoms, so medications will be used in combination with therapy. Psychotherapy, also known as talk therapy, is frequently administered for depression. These sessions focus on identifying maladaptive thought patterns and redirect thinking patterns to become more positive. Treatments for depression can be extremely costly and time-consuming. Researchers have started looking for alternative ways to treat depression that would be more effective and cost-friendly. Researchers have turned to exercise as being an effective treatment for depressive symptoms. Exercise, or physical activity, can be defined as any bodily movement produced by the skeletal muscles that results in energy expenditure. There are many benefits to exercise on one's physical and mental health. For one's body, exercise plays a large role on one's cardiorespiratory fitness, also known as CRF. One's CRF provides oxygen to the skeletal muscles that help produce enough energy needed to live out one's daily life. When an individual is inactive, they will have lower energy levels. One's VO2 max can be improved through exercise as well. This test estimates how much oxygen your body consumes during high levels of activity. Therefore, the more you work out, the higher your VO2 max will be. So we can see that exercise is good for one's physical health. But how does exercise aid in treating mental health problems like depression? There are many hypotheses that try to explain how exercise reduces depressive symptoms, although none of these hypotheses have been proven to be true 100%. The first hypothesis is called the thermogenetic hypothesis. It is credited that the rise in core body temperature after exercise is the reason the depressive symptoms are reduced. When regions of the brain, like the brainstem, become hotter, it leads to an overall feeling of calmness, and it also relaxes the muscles. Along with that is the monoamine hypothesis. This idea states that exercise leads to an increase in the amount of brain neurotransmitters available. Patients with depression have lower levels of neurotransmitters, so exercise replaces these. The final hypothesis is called the self-efficacy hypothesis. Self-efficacy is the belief that one possesses the necessary skills to complete a task. If a depressed patient can increase their self-efficacy through exercise, they will believe in themselves. The American College of Sports Medicine recommends that all adults should exercise at least 30 minutes a day. This can be as easy as a walk through the park or as hard as a weightlifting routine at the gym. Often depressed patients are sedentary due to their symptoms such as lack of energy and low motivation. Therefore, physicians should consider the amount of exercise they prescribe at first so they do not overwhelm their patients. The physicians can counsel their patients to slowly work into exercise and to choose activities that interest them. If the patient likes to ice skate, maybe they could do ice skating for their activity for the 30 minutes. Or if they like to walk their dog, they could take their dog on a 30-minute walk. The physician should also find the correct intensity to begin with so that their patient adheres to the program along with helping the patient stay safe. The two main types of exercise are aerobic and resistance training. Aerobic exercise is any type of exercise that conditions your cardiovascular system. Some examples of this include walking, biking, running, HIIT workouts, and swimming. Researchers have conducted many studies that support the use of aerobic exercise for treating depressive symptoms. These individuals saw an increase in physical health and mental health, along with self-efficacy and overall well-being. Additionally, there is resistance training. Resistance training is thought of as any form of exercise where you lift or pull against resistance. Examples of this include weightlifting, machines, kettlebells, power bands, or any sort of move that involves external rotation. Much like aerobic exercise, researchers have found resistance training to be an effective treatment for depressive symptoms as well. One last factor that should be considered when prescribing exercise as a treatment for depression is the duration or intensity of the exercise. Intensity is defined as the level of difficulty of the moves and rate of exercise. For someone who is new to working out, the intensity should start out slower and easier, so they feel comfortable in their abilities. They are also more likely to adhere to the program when they gain self-confidence. The longer one's workout program is, the more depressive symptoms will decrease. The patients will get more comfortable working out, and time allows them to progress their moves as they see fit. Although longer programs see better progress, studies have proven that programs 6 weeks and shorter also decrease depressive symptoms. Ultimately, the patient should seek help from their physician when deciding on factors such as duration and intensity of their workout program. Overall, there is a great deal of research that supports the fact that exercise can be utilized as an effective treatment for depression. The type of exercise chosen can play an important role in the effects and results experienced by each individual. Most aerobic and resistance training has been seen to provide a great improvement in depressive symptoms. A physician should be consulted to determine their patient's best interest before creating an effective workout plan and before determining the duration and intensity of this program. To obtain the best results, all these elements should work together to assist the individual in gaining self-confidence and improve their overall health. And here are my sources.